Great. Okay, everyone, great. So welcome. My name is Amy Harris. I'm the manager of Oregon's Patient-Centered Primary Care Home Program. And today we are going to be presenting information about PCPCH Standard 6C, Experience of Care. This webinar is part of our series that we've been doing since April around the new standards that will be implemented in January of 2025. And this is a measure that has been in the model for a long time, but there has been some changes to it. So our staff look forward to telling you more about that today. And then we'll have lots of time at the end for you to ask any questions about this measure or any other measures or things that might be on your mind around the new standards. So with that, I'll go ahead and turn it over to my colleagues who will talk to you about this measure.
Good afternoon, everyone. My name is Laura Lee Trocio, and I'm an improvement specialist with the Patient-Centered Primary Care Home Program. My pronouns are she, her, and hers.
And I'm Sumit Singh. I'm a verification specialist with the program. My pronouns are she, her. Thank you for joining us today to learn more about Standard 6C.
First, just a few webinar logistics and Zoom etiquette reminders. The webinar is being recorded and uploaded, and it will be uploaded to the PCPCH program website. If you're having any difficulties, please private message Amy Harris for help. If you feel comfortable, please feel free to have your camera on and put your name and organization's information up. And any questions or comments that you have will be you can put it in the chat, and we will answer them during the question session at the end. Here's the agenda for today's webinar. I'm going to start by providing a brief overview of the 2025 PCPCH recognition criteria. Next, we will dive deep into Standard 6C, and then we will share additional PCPCH resources and upcoming learning collaboratives. And lastly, we'll have some time again for your questions. The Patient-Centered Primary Care Home Program was established in 2009 by the Oregon legislature as part of the state's broader health system transformation strategy to improve access to care, reduce costs for patients, and improve population health. The standard was developed in partnership with an advisory committee and have been revised 5 times since 2009. 2025 PCPCH standards were developed to support OHA's strategic goal of eliminating health equities by 2030. The standards specifically help primary care practices build their capacity and processes to address inequities in their patient population. All practices applying or reapplying for the PCPCH recognition after January 1st, 2025 must meet these new standards. For more information, I'd encourage you to watch the recording of the 2025 PCPCH Standards Overview webinar, which is on our website. So today I'm going to review Standard 6C. Standard 6C is within the core attribute patient and family-centered care, which means individuals and families are the most important part of the patient's healthcare. Care should draw on patients' strengths to set goals, and communication should be culturally competent and understandable for all. The intent of Standard 6C is to be truly patient and family-centered. A primary care home should understand the care experiences of its diverse patients, families, and caregivers, and seek to improve them, as well as reduce disparities in experience when and where appropriate. Strategic survey planning and survey data utilization makes this process meaningful and can have a significant impact on improving patient experience of care. Standard 6C is what we call progressive. So 6C0 is a must pass, meaning all practices in the program must meet this measure. And 6C2 is 10 points. So the last two are optional, and the first one is required. There have been several changes to the overall structure of this standard under the 2025 model. One of the biggest changes is that the higher point measure in this standard, the last two, 61 and 62, no longer require the use of CAPS. While it is still an option, practices may also use other surveys to meet these measures. Measure 6C0 specifications include: a survey is conducted at least once every 2 years with the following criteria. Surveys directly or through a third-party vendor are collected on paper, via phone, or electronically. Surveys are both random and anonymous. Examples of appropriate survey methodologies include distributing a patient survey to every 5th patient, or surveying all patients with appointments during a specific time period. Surveys include questions that assess access to care, provider or healthcare communication, coordination of care, and staff helpfulness. The CAPS survey is recommended but not required, and can be used as a resource when brainstorming survey questions around these subjects. CAPS survey tools are available to the public at no cost from the Agency for Healthcare Research and Quality, AHRQ. The CAPS clinician and group survey with the patient-centered medical home items is what's recommended. Please note, one of the main changes to this measure is that practices not meeting the minimum threshold for provider representation can still meet this measure by demonstrating a strategy to improve survey response rates. More specifications described in our TA guide include: the practice obtains survey results from at least 3% of each primary care provider's assigned patient panel, or has a defined strategy to improve survey response rates, which would include survey times, target response rates, survey outcome goals, and steps to improve the survey experience, making the process more meaningful. All primary care providers with a patient panel must be included in the survey process, regardless of how many hours the provider offers care during the week. Primary care providers who have been with the practice for less than 6 months from the time the survey was administered are exempt from survey data analysis. Practice includes all completed survey results in a report. Let me start that. Practice includes all completed survey results in reported data. 50% or more of the survey questions must be answered for the survey to be considered complete and count towards the minimum requirements of 3% of surveys per provider. Practice routinely shares survey results with their own staff. Continuing on, practices have, an example of 6C0 is a practice is having difficulty applying patient feedback it receives from the survey data to its daily operations, and has challenges with patients completing the surveys. Then the staff decides to create a survey strategy with a goal of increasing the number of surveys returned per provider. They define a workflow to engage staff in distributing paper surveys to patients at every upcoming appointment for a specific provider, rotating providers each month. And they allow time for monthly data entry and tracking. Every 6 months, the survey data is presented to the staff in a meeting and posted on the quality board in the break room. This helps staff feel engaged in the process, identify areas for improvement, and see their progress. As you are completing your PCPCH application, we strongly recommend you gather and collect all documentation that would be needed for a site visit. During the site visit process, you would be required to show the following documentation to the PCPCH program staff to demonstrate you are meeting measure 6C0. And here's what you'll need: a copy of the paper survey or the electronic survey or phone script used to collect patient feedback, provider level data, survey data for each area of the patient experience. This must include survey dates, panel size, and the response rate for each provider, and evidence of the survey results being routinely shared with the staff.
Thanks, Lauralee. Now we will talk about Measure 6C1. A practice is meeting Measure 6C1 if it meets all the specifications for 6C0 and uses its survey data for quality improvement activities. Here is an example of how a practice can meet 6C1. A practice has 2 providers, each with a small patient panel, and has developed its own survey using inspiration from the CAP survey domains. When its quality team meets to discuss survey results, they find that staff helpfulness is their lowest scoring domain. Through a Plan, Do, Study, Act, a PDSA cycle, they develop training for staff to address the issues and continue to monitor staff helpfulness and share results with their staff at all staff meetings. As you're completing your PCPCH application, we strongly recommend you gather and save all your documentation. You will be required to show the following documentation in order to meet Measure 6C1. Number 1, a copy of your paper survey, electronic survey, or phone script used to collect patient feedback. Number 2, a provider level survey data for each area of patient experience, which is access to care, provider or health team communication, coordination of care, and staff helpfulness. This must include survey dates, panel size, and the response rate for each provider. As we mentioned earlier, if a practice is not meeting the 3% per provider threshold, they must also provide their survey strategy. Number 3, the evidence of survey results and how it is shared with staff. And number 4, a demonstration of how practices utilize survey results and quality improvement activities. Next, we will review Measure 6C2. A practice is meeting Measure 6C2 if it is meeting the specifications for 6C0 and 6C1 and includes questions or domains intended to consider or improve health equity in its surveys. Practices can include these questions in their standard survey or administer them as supplemental surveys. Practice may also want to consider how to administer their surveys or collect data in a way that is culturally and linguistically responsive and considers barriers to participation for their patient population. An example of how 6C2 could look in your practice: CAPS offers supplemental questions that can be added to surveys, such as those pertaining to health literacy, interpreter services, perceived biases, people with mobility impairments, and other topics relevant to health equity. Practices can use these questions or identify other equity-related activities or survey tools. Another way is practices develop their own questions and are encouraged to collaborate with internal consultants or external consultants to best capture relevant experience among their unique patient population. As you're completing your PCPCH application, we urge you to gather and save documentation that will be needed for a site visit. At a site visit, you will be required to show the following documentation to PCPCH staff. Number 1, a copy of the paper, electronic, or phone survey used to collect patient feedback. That includes questions related to health equity. Number 2, provider level survey data for each area of patient experience, access to care, provider or health team communication, coordination of care, and staff helpfulness. This must include survey dates, panel size, and the response rate for each provider. If a practice is not meeting the 3% provider threshold, again, they must provide a survey. Evidence of survey results being routinely shared with staff and demonstration of how practice utilized survey results in quality improvement activities. So the PCPCH program is hosting this webinar series to assist practice and other community partners in understanding standards. These webinars are scheduled every other Friday from 12 p.m. to 1 p.m. through December. You can find a complete list of webinar topics and registration links on the program website. The next 3 webinars are listed above. I hope you'll join us, but the webinars will be recorded and posted on our website if you can't make it. These are the final 3 webinars in this series. This final slide contains additional resources that you may find helpful. The first is our PCPCH program website. The second is the 2025 TA guide with detailed information on how to implement every measure and documentation required. Next is our link to the TA resources webpage, and finally, the community engagement report and evaluation. Lastly, you are always welcome to reach out to the PCPCH program with any questions through our program email. This concludes our webinar on Standard 6C. Thank you so much for joining us. Now we'll go through your questions.
I lost my mute button there for a second. Okay, so thank you so much, Laura Lee and Sumit, for that presentation. Before we get into the questions, I just want to add something to the presentation. So when OHA worked with an advisory committee to revise the PCPCH standards, we looked at not only ways to incorporate equity into all of the standards and measures across the model, but we also looked at ways that we could reduce the administrative burden on practices. That was something that was we've been hearing loud and clear for a long time, and we really wanted to consider how we could do that in a thoughtful way, but also maintain the integrity of the standards and the measures. And so I think that this standard 6C, is a really great example of how we were able to do both of those things in one standard. So we added some equity-focused questions as an optional standard for 6C3 or 6C2. But we also no longer require caps, which we had heard could be a barrier for a lot of practices for a variety of reasons. And we also really made the standard for the must pass more flexible around the 3% per provider threshold. So rather than making that a requirement, which could be a challenge for a lot of practices to meet, particularly on a must pass, we gave practices, or are giving practices, the opportunity to do a survey strategy instead if they're not meeting that 3% threshold. So again, just really trying to think about ways that we made the standards, again, less administrative burdensome for practices, but also focused on equity, and really try to take all of those things in mind as we move forward with the new standards. And there's lots of other examples throughout all of the standards as well, but I feel like this one really exemplifies both of those things. So I just wanted to point that out to folks in case you were wondering what we meant when we talk about reduced administrative burden. That's exactly what we're talking about within this standard. So let's go ahead and open it up to questions. I'm going to see. I apologize if I'm a little hoarse. I've been fighting a cold all week. It is hanging on, and it's really annoying me. Okay, so first question right here, perhaps a silly question in which there are none. It says, this is my first time attesting. How do we get the actual CAP survey to hand out? Do we have to order these from somewhere? So it looks like, I don't know if it's Henry Biz or Biz Henry. Sometimes the names are flipped, but thank you for putting the link here into the chat. So I think that is the correct link to get that, to get those CAP survey questions. Is there anything else our team would want to add to that?
I just add that you don't have to order it. You can download it straight from the website.
Great. Thank you, Rachel. Great. Oh, and there are different versions. Kimber Wade said that too. Yes. So that was the only question that was in the chat. So does anyone have other questions that they want to ask about this standard or any of the measures in the standard? Go for it. You can unmute yourself.
Hi, Biz.
It's Biz. Okay, great. Thank you so much. I appreciate that. Sometimes it flips them, right?
So I'm just kind of thinking ahead to our when we'll next attest around 62 and sort of adding or focusing on the health equity related questions, if that's not in sort of our open survey now. in terms of timing and site visit and attestation? Will we be able to attest at 62 based on that's in our plan moving forward? Like that's the survey plan for the next round, or does it need to be implemented already now? Essentially, like in the survey that's open now.
Mhm. Well, when our site visit team verifies site visits, how do you guys look at the surveys? Do you look do you look at when it was last administered, or do you look at when it would be upcoming? I guess it would depend on when the site visit was, right? So that's a good question. I would say that if you are attesting, let's say you're attesting in February, right? And of next year, and you're not planning to do another survey for like another year, then you may not want to attest to that measure, because if our site visit team were to do a site visit for you, we probably would do it in that year, and we'd probably be looking at the last time that you did a survey. So it just kind of depends. But if you're planning on doing it more sooner than that, then you could. So I mean, and there's also a pretty good likelihood that our team would potentially verify that measure with needs attention, maybe if you were planning on doing it in the future. If you said, okay, we attested to it, but we're not really going to do, we're going to do it next time, there's a pretty good chance we would verify with needs attention, which means we verify it. We just say like, okay, you're on the right track. We know you're going to do it. You just haven't done it yet. So it's a little tricky to say. I don't know if that's helpful. I don't know, site visit team, if you guys have anything to add about how you would verify that and the timing of that.
I would just say, in general, whatever you submit to your application is what we assume you are and have been doing for at least the last year. If that's helpful. So whatever measures you attest to, the assumption is that you've already been doing it.
Yes, that you've been doing it. I would say the last year is a little bit challenging, especially with the new standards just being implemented in January. But I would say yes, the idea is that when you're attesting, it is things you already have in place. But again, we can sometimes we're flexible around that when we do a site visit. We know sometimes there's lags in site visits as well from when you attest to when we do a site visit. So.
Just to clarify this, is the concern that you wouldn't have enough survey results from your health equity question by the time you attested or a site visit came around? Is that the concern, or just
thinking proactively? We have a survey open right now that presumably we close in the next couple of months. It doesn't have per se any specific health equity questions that like based on like looking at the standard, looking at examples and making sure that we're meeting that. I don't think that there's something that specifically sort of gets at that. And then our next survey period at earliest would probably be summer, when we would be able to put that into the template of the questions we're sending out. And I think we're set to test like in May, so it'd be a little bit ahead of that. And so like what we're currently doing meets the current standards, but we haven't necessarily added that new layer, which I think we would probably intend to do. But I just, the way the timing is, it's a little on the edge. So, and we can look at it further as we get, I don't know if we need to meet that measure for that attestation, but just kind of thinking through what that timeline might look like and when we could implement that change.
Yeah, I would say, so if you're doing May and you think you'll probably add those questions in the summer, definitely reach out to us next year and just let us know for sure. But that would probably be okay. I mean, we probably aren't going to we're probably not going to site visit you immediately. So it probably would be fine. So, and plus that's great. I mean, we want to see practices doing this work, right? So that's awesome. So yeah, of course. And we want to support that. And we want you to get, the credit in the model for doing that work. So for sure. So, yeah, sure. And if I'll just say too, just in general, if folks have other questions about that, if there's things around timing, or reach out to us. Like we totally can give you some guidance around that as well. And again, we want to make sure that you're getting, like I said, credit in the model for doing the work that's in these new standards. So definitely reach out to us around some of those if you have timing questions around any of the measures. So, okay, so let's see. It looks like there's some more questions. Can you talk more about the option for doing supplemental questions with equity? Can we distribute the interpreter services survey as a separate survey? Oh, that's an interesting question.
I can answer that one.
Yeah, go for it, Rachel.
Yeah, so the answer is that yes, you can. You can either include the health equity questions in your standard survey or administer them as a supplemental survey. And that's actually specified on page 154.
Great. Thank you for that, Rachel. Rachel knows our TA guide, I think, probably better than anyone on the team because she does all the editing and the writing. So whenever we have clarifying questions, we always ask Rachel because she knows it very well. So thank you, Rachel. Other questions folks have? Well, one question that we've had come up, and we actually were talking about this as a team before we started this webinar today, is for the question, or for the 6C2, which requires you to add equity questions into your survey. We've had the question come up about how many questions do need to be in the survey, because we don't actually specify that in the TA guide. So in case anyone's wondering that, the answer is more than one, but we're not telling you a specific number. We want the questions to be meaningful and to be helpful for your practice, but also we understand that surveys are different lengths, and sometimes practices intentionally keep survey questions short so that are surveys in general shorter, so that they can ensure that patients will fill them out, and it helps with health literacy. And so again, we're not giving a specific number of questions. We would just say more than one to make it a bit more impactful. So we've had practices reach out to us with that question. So I thought I would just share that information here. Anything else folks have around this standard? Okay, any other questions about any other standards or measures or applying? I will just quickly plug our self-assessment tool. I don't know if Rachel, you want to drop that in the chat, or I can drop it in the chat. So Rachel has been sending emails out to the contacts that we have for the program, for the PCPCH practice contacts that we have, with a link to a self-assessment tool that practices can complete before the application opens in January. And it's essentially an Excel document that has all of the application questions in it. So it really helps practices to prepare and know where you're at before you even apply in January. So we are really encouraging practices. We have always had this tool. It's always been, even if you could get it for the current application, but especially with the upcoming changes, with the tiering structure changes and the health equity designation and all the new measures, we really are encouraging practices to take advantage of that tool and utilize it, so that you can kind of know where you might want to make some changes to your practice, if you're not meeting as many measures as you hope to, or maybe you'll be surprised that you're meeting more than you anticipated. So really using that tool in advance. So hopefully folks are taking advantage of that. And again, if you have any questions about that tool, you can always reach out to us as well. Rachel developed it, so great. Oh, and thank you so much for the comment that the webinars have been helpful, and the tool, great. We're really glad to hear that. So good. So okay. Well, with that, we'll end today. Happy Friday. It's rainy in Portland, so it very much feels like a fall day. So we hope to see you all next time, and thank you again for joining us, and have a great day. Thanks, everyone.
Thank you.